Hey everyone, and welcome back to Study Nurse IQ. I'm Ginny, and today we're diving into the essential cardiovascular diagnostic tests and lab values. Knowing these numbers is critical for your nursing exams and for patient care. We'll break down everything from cardiac enzymes to cholesterol and coagulation studies. Let's get into it. Cardiac enzymes, the gold standard. First up, let's talk about the cardiac enzymes and proteins released into the bloodstream when the heart muscle is damaged. These are a key part of diagnosing a myocardial infarction or heart attack. Myoglobin. This is a protein found in both heart and skeletal muscle. While it elevates quickly, 2 to 3 hours after injury, it's not specific to the heart, so a high level could be due to other injuries, like from a car accident. This enzyme is more specific to the heart. It will elevate 3 to 6 hours after cardiac muscle damage and can stay elevated for a few days. Troponin 1 and T. These are the gold standard for diagnosing a heart attack. They are proteins found only in cardiac muscle fibers and are the most specific indicators of cardiac damage. They rise 2 to 3 hours after injury. Troponin T stays elevated for up to 2 weeks, T for 2. Troponin 1 stays elevated for up to 1 week, I for Roman numeral 1. Since these are normally at very low levels, any significant elevation is a serious red flag. Cholesterol and lipid panel. Let's look at the numbers that tell us about a patient's risk for cardiovascular disease. Total cholesterol, we want this to be under 200 milligrams per deciliter. This is the lousy cholesterol. We want it under 130 milligrams per deciliter. A high level is a major risk factor for atherosclerosis. This is the happy cholesterol. We want this to be over 45 to 55 milligrams per deciliter. HDL helps remove LDL from the arteries, so a high number is a good thing. Triglycerides. These are fats in the blood, and high levels can also increase heart disease risk. The normal range is typically 40 to 160 milligrams per deciliter for men and 35 to 135 milligrams per deciliter for women. Coagulation and other important labs. Some other key lab values you'll encounter in cardiac care includes APTT, activated partial thromboplastin time. This measures how long it takes blood to clot and is used to monitor a patient on heparin therapy. The normal range is 30 to 40 seconds, but for a patient on heparin, we'd expect it to be 1.5 to 2 times that normal value. PT-INR, prothrombin time international normalized ratio. This is used to monitor a patient on warfarin therapy. The normal INR is around 1, but for a patient on warfarin, the therapeutic range is typically 2 to 3. D-dimer. This lab value is used to rule out the presence of a clot, like a DVT, deep vein thrombosis, or a PE, pulmonary embolism. A normal D-dimer is very low, under 0.4 milligrams per milliliter. If it's elevated, it can indicate a clot somewhere in the body. HBNP, human B-type natriuretic peptide. This is a hormone released by the heart ventricles when they're overstretched from fluid overload. A normal level is under 100 pg/mL. If the HbMP is elevated, it's a key indicator of heart failure. NCLEX-style quiz. Ready to test your knowledge? Here are 3 NCLEX-style questions to review what we just covered. Question 1. A nurse is reviewing the lab results for a patient admitted with chest pain. The troponin I level is 0.08 n-grams per milliliter. The nurse understands that this value is within normal limits. B indicates a myocardial infarction. C is a normal finding for someone with chest pain. D is a definitive sign of skeletal muscle damage. Correct answer B indicates a myocardial infarction. Rationale. Troponin 1 is a highly specific cardiac enzyme that should normally be under 0.03 n-grams per milliliter. Any elevation above the normal range is a strong indicator of cardiac muscle damage, such as from a myocardial infarction. Question 2. The nurse is monitoring a patient on heparin therapy. Which lab value should the nurse prioritize to ensure the medication is at a therapeutic level? Option A, D-dimers, B, PT-INR, C, APTT, D, HbNP. The correct answer is C, APTT. Rationale. The activated partial thromboplastin time, APTT, is the specific lab test used to monitor the effectiveness of heparin therapy. A therapeutic APTT for a patient on heparin is typically 1.5 to 2 times the normal control value. Question 3. A client's HbMP level is 750 pg/mL. The nurse recognizes this result as a key indicator of which condition? Myocardial infarction, pulmonary embolism. C. Heart failure. Hypertension. Correct answer C. Heart failure. Rationale. HBMP is a hormone released by the ventricles in response to fluid overload and stretching of the heart muscle. A level significantly higher than the normal Bleth 100 p/ml is a strong indicator of heart failure. And that's our rundown of key cardiac labs. I hope this helps you feel more confident in your studies. Remember to like, comment, and subscribe for more Nursing Made Simple content.